Genetic testing in CLL is having increasing importance as we are entering into an era where we're able to select therapies based on patients' molecular genetic profile. Certainly, right now, we're at a stage where we can use genetic testing to identify which therapies are not appropriate for patients. Chemoimmunotherapy, which used to be the mainstay of CLL-directed therapy, should not be given to patients based on IgHV status, unmutated disease, or patients who have an interruption of TP53, either a deletion 17p or a TP53 mutation. And what I'm trying to say here is highlighting the importance of performing these types of tests in patients prior to making a treatment decision. It really helps to guide patients away from therapies that are frankly inferior at this time and guide them more towards targeted-based therapies. My hope for the future is that we'll be able to use molecular and genetic testing to really guide specifics. Like, for example, should a patient receive a BTK inhibitor? Should they be receiving a BCL2 inhibitor? What sequence of therapies are most appropriate? Are certain mutations predictive in advance of therapy of potential resistance mechanisms? Also, in addition to pre-treatment testing, we now have the ability to test during therapy for mechanisms of resistance. Probably the most common one that's tested for presently is a CYS481 mutation. And I think all of this is really interesting, but probably one of the most important pieces of information that we presented at the most recent ASH meeting was the fact that prognostic testing is not universally performed, even in the current era of novel agents. I presented some data on behalf of the investigators of the Informed CLL registry, where we looked across several sites, more than 100 sites in the US, at just the basic question, is FISH testing performed? Are cytogenetics performed? Is IgHV testing performed? And actually, those tests in our patients here were only performed in the minority of patients, really supporting the need to have a campaign and an educational campaign to really support appropriate molecular and genetic testing to guide treatment decision-making in CLL. So an important topic, getting more and more sophisticated on one end, but on the other end, not being performed routinely in community practice and some academic sites. And so an important area where education should be not only directed at practitioners, but also at patients to make sure the appropriate testing is performed in order to guide important steps for our patients.